if we could just have some general guidelines. One of my colleagues will be muting you as you appear. If you do have any questions, you can use the chat box. Marcus will be keeping track of questions, and I'll be doing my best to address those as we take a short break in the middle and then at the end of the webinar. We're also going to be recording the webinar and make it available to you in the future. So here's a brief outline. I'll just give a very quick introduction and then jump right into a couple of demonstrations of what you can achieve using our software and services with fragment-based design. I'll then take a quick Q&A on that first part, and then have a second short demo of more elaborate techniques, fragment growing and fragment linking. And then maybe after 45 minutes we'll have a further Q&A and then a close. So as I said, if you have any questions, just type them in the box, and when we get time, I'll get to them. So a bit about me. I'm a medicinal chemist by training, over 10 years. Started with Cancer Search UK, worked for Chroma Therapeutics in Oxford, UK, then a brief spell with Argenta, and I've been working at BioSolveIT for nearly a year now. I've got a PhD in Cambridge in organic chemistry. That did an undergraduate degree in Glasgow University in Scotland, which probably explains my accent to many of you. The company itself has a full suite of structure-based, fragment-based, ligand-based design software, which interfaces with many of the most commonly used industry tools such as Mo, Pipeline Pilot, and KNIME. And I'll be hopefully showing the utility of KNIME in a bit more detail. If you want to keep up to date with what's happening with software development and new releases, then there's a couple of ways you can do that. You can do that through our LinkedIn group, and quite often what will happen is that when free tools become available, those will become advertised on LinkedIn or through Facebook. So I encourage you to join one or other or both of those two channels, help you keep up to date with what's happening with the latest releases. So really to start to dive into the main thrust of the webinar is why would people think of doing fragment-based design. And looking at the bigger picture, conventional wisdom is that fragment-based drug design sits in the sweet spot of being able to generate highly optimizable hits at moderate cost in a very rapid fashion, and so sits right in the middle of this triangle of spheres here. And that's certainly my experience. That the first project I ever worked was a fragment-based design project, and it demonstrated to me the utility that fragment-based approaches have in drug discovery. And so then if you start taking a look at the how of fragment-based design, this recent paper from Davis and Erlandsen shows the broad spectrum of techniques that are used, and my belief is that computational techniques can perhaps be most useful in helping to reduce the chemical space that we might start with and dial down into some much more focused fragment space to enrich our fragment collections prior to the application of additional screening technologies. So this is an image from Chris Abel's group, DOI, a Nature paper, which outlines the kind of funnel that people normally undertake when they're starting their fragment-based discovery. That they'll take a large collection of compounds, about 1,000 or more, and do some DSF and use those hits to do a further a couple of narrowing down the candidates for elaboration. So where computational techniques sit initially is helping to generate this fragment library to give you the best chance of finding some really interesting chemical matter at the outset of your program. So in terms of fragments, what I hope to show is what you can achieve, how you could go about doing that, and how BioSolveIT and our software suite and our services division can help you achieve that. And I'll hope to do that with helping you to ID druggable sites and assess druggability, to outline some best practices in virtual screening, specifically virtual fragment screening, how you might go about generating fragment databases with reliable 3D structures, and then how you go about executing your virtual fragment screen, and then how you would expand the subsequent search space that's perhaps more fragment elaboration and fragment linking approaches. So firstly, if you want to assess the druggability of a new drug target, the demo that I've picked here is AKT1, which is the first project that I worked in industry, and it's a kinase, so right from the get-go you're probably thinking this is quite druggable. But if you want to have a new target, you might not have any idea of binding pockets and how likely you are to be able to find chemical matter. So one tool available is called Difference of Gaussian Site Scorer, or DOG Site Scorer for short, which is offered by the ZBH, our academic collaborators. And all you have to do here is simply enter a PDB code, which you can find from the RCSB website. And the code I picked was 4GB1, which is the crystal structure of the AZD5363, the clinical candidate from AstraZeneca in this area. And if you fill your email address when you submit that request, the website will email you back a PDB file which describes all the pockets. And that's very useful for visualizing the pockets. You can start to get a real idea of the geometry and interactions that the molecules might be forming in 3 dimensions. So using that tool, what I've done here is to generate a nice picture of the ligand sitting in the active site. And I can analyze that and find out that the pockets that my molecule is binding in are pockets 0, and then subpocket 0, pocket 0, subpocket 1, and pocket P2. And what the website also does is to give you an idea of how druggable it thinks those pockets are. So here we've got a combination of 2 very positive scores, which, as I said, this is a kinase enzyme, so it's highly likely that you'll be able to find small molecule inhibitors of that site. So what you can also do with the PDB file is that source from RCSB. If you scroll down on the web page of the hit of 4GB1, you will come to the ligand chemical component box. And as part of that, here we have the chemical name of the ligand. There's also this small box here, which will give you a link to a pose view image of the inhibitor in the active site. And this is particularly interesting if you're looking to build in pharmacophore elements into your binding site, that you can readily pick out known interactions that you might hope to target. Of course, if there's no known ligands, then you might have to guess at some likely interactions that you might want to build in if you want to include pharmacophore elements in your binding model. And that's just a very nice snapshot of the ligand in the active site. So to really get started, what you first have to do is to define a binding site for your fragments. And this is the end product of my creation of a binding site for AKT. And I'll just quickly show you how you can go about doing that yourself with BioSolveIT tools. I'll just quickly switch window here to Leadet version 2.1.6. As part of the incentive to sign up to the webinar, you're of course offered a free 2-month evaluation license, which will enable you to do this for yourself. So within Leadet, we have the choice of to load a protein from the PDB server directly, or in this case, of course, I've prepared this in advance, so I've just got a file here. And when you load your file in, it will show you the protein in here, hopefully in the middle. You can see that the ligand is sitting in place. And then in the text view, we can see the real details and the specifics of the atomic coordinates and the details of the experiments undertaken that led to the submission of that PDB file. So in order to start generating the active site, it's really very simple. Take on to the next step. Now our protein here only has one chain, so that step is fairly straightforward. Of course, if you have more than one chain, you might have to have a couple of efforts at picking the ideal binding site. I just click on Advance. And now, the really nice thing about having a ligand in the active site already is that we can use that as a reference point for defining our binding site. So here, I've selected the ligand, and then a radius of each atom of 4 angstroms. I can also describe the binding site by manually selecting residues. That's of course a bit more cumbersome, but certainly achievable. And then just click on the advance arrow, and this is where a bit more attention to detail is required often, that sometimes you have ambiguous amino acid side chains, usually asparagines, where the electron density of the oxygen and nitrogen of the side chain is not directly indicative of the atomic positions. Another careful thing to note is water molecules in the active site, which can have a huge impact on the outcome of your docking here. Our receptor intelligence technology has decided that we want to keep this water here. You can have a brief look at that. If you don't want to include that water in the binding site definition, all you have to do is uncheck it, but I'll just leave it as is. And then we have another chance to include or exclude small molecules. So I just click on Advance, and then the mechanics of the software clicks into place. Now, I've been flagged as an error here because I'm re-performing this, but that's normally not a receptor problem that will occur if you start afresh. So I just finish and click Done. And you can see here, I've now defined my binding site. And it's really that easy. All I have to do then is save that. I've saved it as 4GV1, and we're ready to go. One additional point is that if you want to include from pharmacophore in your fragment screen, then you have to set that up at this point. So I'll just quickly demonstrate how you do that. You would go to the docking menu, and then you want to define a pharmacophore and click on Define. And then it comes up with a big list of options of possible interactions we might seek to specify. Here I will just replicate what I already had defined, which is an H-bond donor. If I click on the H-bond donor button, everything else is whited out. Hold on quickly, I shall get rid of the protein surfaces here. Make it a bit easier for everyone to see. So now hopefully you can see, I'll zoom in a bit, that here at the base of the active site we have the hydrogen bond acceptor and donor pattern, and then to include these as pharmacophore elements to drive the docking, all I have to do is click, and then if I want to include the acceptor, I just change the category to acceptors, scroll round, click. So now as part of that pharmacophore definition, they've automatically been assigned as being essential. And I might wish to keep it that way, but I also might wish to make either of them optional. And then by scrolling down a little bit, you can see that here we have defined that we must match one of those constraints. Of course, if you introduce multiple extras, you can have a minimum and a maximum of as many as you like, and you can combine those using logical expressions also, which gets useful when you have 3 or more. And the important thing to do here is, if you want to include that in your docking operation, then if you click on OK to save the pharmacophore, then what you need to do is go to the docking menu, click on Define FlexX Docking, and then where the pharmacophore is defined, the one that I just did was Pharm2, you have to click on that and then click on OK and then resave. So I'll just click on Save Project. And so now when I run the docking, that pharmacophore element will be included. If you don't go to the docking menu and click on choose the pharmacophore and then OK, it won't remember that you want to do that. So that's just an important thing to note. So now I shall quickly switch back to my main project. So here's just the summary of the docking binding site that I defined very quickly there. If you want any more detail on that, there's I think in a YouTube channel, a demonstration of how to set up a binding site, which can help you also with that process. So that's done. So now we've taken care of one half of the process. We've defined our binding site. Now we're looking to create some fragment libraries. So there's of course zinc. Just been asked to remind you that if you want to raise a question, then please just type it in the chat box. I will shortly be coming to take some Q&A, and if you do have anything, then it will be addressed. So any questions, just type them in the box and I'll pick them up soon. So in terms of fragment libraries, you've got zinc, you've got e-molecules, and then there's a whole host of vendors that will offer you customized fragment libraries. But what I tend to do is just to download the entire compound sets and then custom filter those for myself, because that really allows me a degree of control that I can accurately and reliably generate exactly what I'm looking for. So it tends to be that I'll stick with things like the rule of 3, so molecular weight less than 300, S log P, H bond donors and acceptors, and a PSA limit. And then quite often other common filters I might use would be a heavy atom count of at least 9 atoms. That tends to eliminate highly scoring, very tiny fragments that are of no interest. If you limit the number of rotatable bonds, you can also have a fairly good impact on the quality of results. And some vendors flag solubility as being important because, of course, fragment screening is generally run at higher concentrations, and therefore solubility becomes a much more important parameter for your collection. PAINS is one here. This is a pan-assay interference substructure matching system, which I tend not to use because often fragments tend to have reactive, or not highly reactive, but aromatic chlorinated heterocycles and the like, which are used as synthetic handles, and those would be filtered out by a PAINS screen, so I tend not to use the PAINS filter at this stage. What you can also do is generate some smarts patterns to help bias your set if you have any knowledge of likely binding modes. So in this case, I've of course picked a kinase, and a very common motif there is an aromatic nitrogen in a 6-membered ring without a hydrogen bonded to an aromatic carbon, also in a 6-membered ring, single bonded to, in this case, I've got an aliphatic nitrogen with 1 hydrogen or 2 hydrogens, an OH, or a carbonyl. And you can quite easily filter sets using the tool Mona, which is available from our website as a free download. It's a really nice way of doing smart pattern matches and filtering. It's really, really effective at doing that. So overall, what you're looking at here is reducing down from about 42 million compounds if you take the entire e-molecules database plus zinc. That's everything clean and the boutique compounds, which are a bit more exotic. And then you apply all those filters that you might wish to do, and you might end up with about 100,000 fragments as a virtual set, which you want to screen in order to enrich your fragment screening set. So now we're ready. We've got everything in place. Virtual screening. So doing this in an automated fashion enables us to screen large numbers of small molecules. Without automation, there would be no way you could manually dock and score all these in a reasonable timescale. And to do that, I use a tool called KNIME, which is it's extremely useful. There's huge functionality in KNIME. It's cross-platform, it's free, and it's very well supported by the cheminformatics community. And BioSolveIT software is fully integrated into the KNIME environment. We have 9 nodes to do all our software manipulations. So to demonstrate, if you want to generate reliable 3D structures, there's a node, generate 3D coordinates, which is fairly self-explanatory. If you want to generate multiple docking poses, then you use the compute Leadet docking node. In general, I'll pick between 3 and 10 poses per fragment. It really depends on your preference for speed or accuracy there. What we then do is accurately rescore those poses using the hide scoring function with the assess affinity with hide node. And then we can also use KNIME in the post-processing of the hits. So this is what you end up with. Some workflow that looks a little like this here at the beginning. I'll just switch tool here. Oh. Anyway. It's not working for whatever reason. At the beginning, you read in your compounds, there's an SDF or a mol2 file, and you generate 3D coordinates for those compounds. Output of this node should preferably be in mol2 format. That's the tripos format, which works better in KNIME with our nodes. And at this point here, compute Leadet docking, that's where the project file that we defined in the interactive session is read in. So that's the 4GB1 project file definition that we made some moments ago. And then what happens then is you can filter out poorly scoring docking poses if you wish. With fragments, I tend not to do that because the docking scores between poses is less clear cut than with larger molecules, and the loss in speed is not so terrible for including all the docking poses. We then rescore with hide, sort by hide score, and then we group to create a unique solution for every one of our molecules. And so using a very powerful desktop PC, you can probably dock and score about 50,000 fragments in 24 hours if you're docking about 10 poses. But of course, if you want to dock more poses, you're going to be spending longer to do that. And so if you want to dock and score hundreds of thousands or even millions of fragments would be possible, you're going to need to cluster or parallelize your execution. Just a little brief comment here that with 50,000 fragments, that's a 6-core PC, which is running at 4.6 gigahertz with bags of RAM. So it's expensive, but a typical desktop, not workstation. So just bear that in mind. And so what I've done is I ran a very mini screen just to demonstrate using a kinase-like set of 2,565 fragments. And then what I've done is sort the output by ligand efficiency, which is here, or by absolute hide score. And the reason I've done it both ways, it's very easy to do, that you just have a sort button here, which you bring down a drop-down menu. You'll be able to choose which kind of sorting you wish. So that process on a very small set picked out some very interesting little fragments. So here's this hydroxypyridine fragment, which scores very well with very good ligand efficiency, and this is the pose as coloured by the height scoring function, where green atoms mean they're making a very positive contribution to the binding energy. So you see lots of green atoms. There's a couple of hydrogen bonds here. There's the hydrogen bond here, which those are the two that we specified. And so that looks like a very encouraging start point. The second hit here, the amino isoquinoline. Again, lots of green atoms, very good ligand efficiency. So where that takes us is that we might then wonder, well, can we actually find real fragments, how they bound? So here's the fragment 7-aza-indole, which is in the PDB also. This is a real fragment hit against AKT. This is the docking pose as suggested by FlexX. This is the pose as rescored by Hyde, and this is where scoring by ligand efficiency becomes, the benefit of scoring by ligand efficiency becomes evident. That here, of course, the previous molecules were scoring in the minus 40s. Here it's not so good, but the ligand efficiency is really good. So if you're looking to generate high quality start points, you might want to look at optimizing or focusing on ligand efficiency as a metric of ranking compounds. And this is the crystallographically observed pose. So you can see it's almost indistinguishable from the high scoring pose, which is encouraging that we can replicate the experimentally observed poses so reliably. So once you've docked and scored all your molecules, there are a few other things you can do within the KNIME platform that will help you to filter your hit list down. One thing I tend to do is look to eliminate molecules with high clash scores. These often turn out to be false positives. One of the outputs of the Hyde scoring function is an intramolecular clash score, and you can simply set a cutoff of around 100 or even 0. Anything less than 0 is very, very much preferred. You can also use KNIME to help visualize poses and manually filter results. You can generate PDF reports with KNIME, and you can also start adding in some molecular properties, descriptors, and fingerprints for each molecule that you identify. You can then cluster your hits by, of course, a common Tanimoto coefficient. And you can also start to think about taking a step beyond the virtual screen. That once you have some crystallographically or NMR validated hits, you can then start doing some in silico analog design and virtual chemistry to help chemistry teams with their follow-up studies. You can also help with compound purchasing. You can export STF files which vendors can then order compounds for you in a very rapid fashion. So I wanted to take a quick look at some fragment elaboration growing, and so I picked a fragment which came out of the screen I mentioned earlier. This isn't a real fragment hit, this is still entirely virtual. And so this chloropyrazine has a very efficient and reasonably potent score. But of course, the synthetic chemists amongst you will look at this and say, well, yes, we can use that as a very attractive synthetic handle. We can really use some real chemistry on that and start. Excuse me 1 minute. I have the usual problem there with Windows. So you can really start doing some real chemistry. And of course, on paper, it looks straightforward. And in synthetic chemistry terms, that's very probable. So we can start building reactions in KNIME, taking the output of our docking experiment and feeding that into some reaction nodes. So this is from RDKit. It'll take a collection of amines, and then we can read in one of our hits, and we can then computationally enumerate a fragment library, an in silico fragment library, which we can then, of course, dock and score. So here I've chosen to filter off anything better than 250 AMU. I wanted to keep these really fragment sized, and this is what the output of that was. So using only reagents from one vendor, Sigma Aldrich primary aliphatic amines, that generated a hit with a significantly improved predicted binding affinity. And it looks like a very reasonable binding mode. All the atoms score very well, except this one. This is flagged in red by the Hyde scoring function. And one of the attractive features of the Hyde scoring function is that automatically flags that atom as something that I might look to replace. So in our molecule, that's an NH. Automatically, you're thinking, can we switch that for an oxygen? And yes, you can. The potency improves if you switch that to an oxygen, or the predicted potency improves. So we've got a huge variety of chemical reactions you can do in KNIME. We've encoded those ready for use. You can choose reliable suppliers of building blocks. You can filter reagent sets using your tool. You can enumerate those virtual libraries, and then you can filter your output sets by whatever desired molecular properties you might have. And you can do all that within the KNIME workbench. And you can use those tools to feed ideas directly into your design and synthesis cycle. So it's really nice system of generating and developing ideas. So that's a short testimonial on the use of Hyde, which from Bayer Crop Science. They have very successful 70% hit rate, which is of course exceptional on the top side. But typically, Hyde has been generally very successful in enriching screening sets. So I'll pause there briefly and take questions from those who might have them. So Marcus, you want to jump in and help me out here?
Yeah, absolutely. Can everybody hear me? What do you think, Alistair? Are you hearing me loud and clearly?
I can hear you loud and clearly, yes.
Okie dokie. So there is one question actually in the chat box. Fragments are very small. We can think to use them for developing a molecule as a drug that contains a fragment in order to improve the binding energy of the final molecule. Is that correct? Can you comment on that a little bit?
Yeah, I mean, the idea is that these serve as high quality start points for developing drug molecules, yes. I think the philosophy is that if you start with something that is very efficient in its binding, that as you elaborate that molecule, you obviously look to improve the potency, and because you've started from a very efficient start point, that the final end point of your journey is a very efficient drug. I think the analysis of drugs derived from fragment hits suggests that they're pretty similar to hits, leads and drugs discovered other ways, but that perhaps the journey to get there is that bit shorter.
Yeah, perhaps you can also say a few words in the context of what this LE is and what its importance is or has been in the fragment-based arena.
Okay, yes. Well, LE, ligand efficiency, is a measure of potency of the fragment for every heavy atom. And so there's a variety of ways of measuring that, depending on where you work or who you believe. But in general, a ligand efficiency of 0.5, of course expressed in the correct units, is believed to be highly efficient. And so some of the fragments here demonstrated were 0.7, 0.8, but of course there is a size dependence of ligand efficiency. So as you get smaller and smaller, the ligand efficiency will appear somewhat artificially improved. And so I would just, as a guideline, say anything better than 0.5 is probably pretty good. So we've got another question here, which is, which results are more important to the cutoff? So docking energy value or ligand efficiency value? It's really a personal choice. I think if you ask a medicinal chemist, they'd probably rather have the more potent hit to start with. But then small fragments have their advantages, that you of course have fewer atoms, and you can very often in a small fragment tweak the vectors of your substituents that bit more subtly, whereas with a larger fragment you might be more restricted. And so if what you're doing is using the computational screening as a feed-in mechanism for your physical screening, then it sounds a bit of a cop-out, but you might want to just take the best of both. Because what will probably happen is that many of these will turn out not to be validated in multiple biophysical experiments, and that's really what people look for these days, is validation in 2 or even 3 different technologies. And so I wouldn't worry too much about it at the early stage. But the example I gave, the AstraZeneca AZD5363 compound, was actually derived from that 7-aza-indole hit. So the less potent, but almost equally as efficient ligand. And so it's really a matter of personal choice. I don't think either is better than the other. So maybe I'll quickly move on, and if there are any more questions, I'll be happy to grab those at the end. Okay, so for the second, maybe the last 10 minutes, a slightly different focus, which is taking fragments from 2 different binding pockets and then trying to work towards joining them together. And the protein I chose for this is called SND1, which you can see here is this is a dimethyl arginine binding pocket, and down here there's an alanine residue sitting in another binding pocket. And so what we would probably do is, as I've just described, undertake a fragment screen for this pocket up here, a second fragment screen for this pocket down here, and then first option is to grow fragments out from there, or to join those 2 fragments together. And one of the things that our software is very good at is this fragment linking technology. So again, this is all virtual chemistry. These aren't crystallographically observed binding modes. This is just the docking pose. So imagine, for the sake of argument, that the fragment that you have identified binds as shown here. We've got this imidazole in the binding pocket of the dimethyl arginine. And then in the alternative binding site, we have this phenyl aniline amide. And what we can do is, with our software called ReCore, we can load those 2 molecules into ReCore, and automatically you can see ways in which you might join those together. Of course, as a chemist, you might have chemical intuition about the best ways to link them together. But the advantage of ReCore is that it's based on the shredding of based on retrosynthetic rules. So everything that ReCore suggests should be synthetically accessible. And here, what I did was to take those two molecules. This green wedge here indicates which part of the molecule I've chosen to keep. So obviously I'm keeping the portion up here in the binding pocket. And then the second pocket, the second green wedge, here. So once I've done that within ReCore, what I can do is take the ReCore solutions and feed them into my docking, and scoring, and sorting protocol. And then I can generate a prioritized list for chemical synthesis for joining my crystallographically or NMR validated hits. And so, of course, ReCore isn't intelligent in the sense of being able to dock in situ. Instead, you have to take the extra step of docking and scoring and then filtering. So doing that with this precise example suggested that this would be a fairly potent replacement for that linking unit. Remember, what I can do is specify things I don't want to see. So here, of course, I've got this diaminobenzene, which from a medicinal chemistry perspective might be undesirable, but I'm sure you get the general idea that if you wish to generate a large number of ideas automatically and on the fly, then this can be a very powerful approach to generating some new ideas. And with that, I shall draw to a close and just let you know that if you have any interesting targets, you're looking for someone to work with, do some virtual screening, library design, SAR analysis, and all these things that I've just shown you, then our services division is here to help. Of course, we have lots of in-house expertise, all the software tools at our fingertips, a powerful CPU cluster that we can make these things happen for you. And otherwise, you can of course use your evaluation license and give these things a go for yourself. Hopefully the software will prove to be very useful to you, and you can then have a test, have a play, and find out how it works for you. So with that, I shall open the questions and happy to address anything you might have to ask.
Maybe just a side note from my side, Marco speaking. I sent a few private chats out there to people
Okay.
who were very hard to identify or unidentifiable. So it would be great if you could identify yourself by the email address that you used while registering, so that we can actually send you the extended free trial licenses out after the webinar. So if you just type it into the chat box and address it to the organizers or to the moderator, then you should be good to go with your license. That would be nice. Thank you.
Yeah, it's, if you are interested in obtaining your free evaluation license, then if you've registered for the webinar with an email address but you haven't typed it in here, we can't always match up who is who, and so we don't know if you've attended, whether you then get your license. So if you are wanting an evaluation license and you didn't type in your email, we're not sufficiently psychic to know who is who. So if you do want that, then you should type it into the box. So we've got a question about ReCore. ReCore is provided with a fragment database that you install when you first install the Leadet package, because ReCore comes as part of Leadet. It comes with a demonstration set. There are additional sets available, or you can create your own set based on whatever you have in-house. So if you have your own chemical collection or screening libraries and you want, or reagent sets, you can do that yourself. But it does come with a very workable set of database linkers. So, no one else got any? Okay. Well, with that, I shall say thank you. And if you provided your email, then your trial license will appear very soon. Otherwise, if you are interested in the more services side of the division, if you just tell us your target, and we'll be happy to run a small pilot study for you. And we can try and convince you that our software and we're worth working with. And so thank you very much, and goodbye.